why do people in type 2 diabetes require insulin? Mainly because by the time you get diagnosed with diabetes, the 50% pancreas is gone. And insulin is not the complications of diabetes. If you have these complications, which include stroke or heart disease or eye disease or nerve problems, erection difficulty, repeated infections, and others are the complications of diabetes. Insulin is to avoid these complications that what you have, rather than insulin is a complication of diabetes. So some people think insulin is the last stage of diabetes. Insulin makes you addicted. Insulin is the only option after you put on insulin. So these things are complete myths in the society that look, insulin is a treatment option. So what I'm trying to come back, insulin is a treatment where we can slow down or prevent this further happening on a long-term basis. So if you, one of the tests very important called HbA1c, besides doing other tests, which is very relevant at this stage to make sure that your average 3 months sugar levels are fine. Otherwise, we do the liver function, the thyroid function, the kidney function, the leukoprotein, and eye test as a part of the routine diabetes management. And if you look at the pancreas, which is just part of the organs, which has got different cells, one of them is beta cells, which produces insulin. And if the beta cells get affected, the amount of insulin which is being produced by beta cell goes down, then you develop diabetes. So the role of insulin is to catch glucose and then puts inside the cell. If there's not sufficient insulin there, then not sufficient glucose is going very high in the bloodstream and tends to damage the blood vessels and leads to different complications. That's what we discussed. So it's very important that insulin should be there, and any medications we try to give it to you ultimately either increases the efficiency of insulin or squeezes the pancreas to produce more insulin. And at a point that all these medication tends to fail and we have to give you insulin shots. And just because it's an injectable therapy, that does not mean that it's not safe. It's a completely safe therapy. And otherwise, other medications, if that does not work, that will lead to other complications on long term. So it's very important to understand that insulin just opens the door so that glucose can enter inside the cell. And the other thing to understand that, the relationship of the weight and diabetes, that once your weight goes up, the insulin effectiveness, we call it insulin resistance, goes up. It means you require larger amount of insulin for the same glucose control. And ultimately the pancreas get affected and the insulin production tends to go down and the blood sugar starts going up. This is the point that when you develop diabetes, where you have high insulin resistance, you have insulin production going up high and the blood sugar is still normal. A point comes when the insulin production tends to go down and insulin resistance remains the same and the blood sugar starts going up. And over the period of time, the insulin production goes down. So that's what the diabetes is all about. And the insulin secretion is secreted in two phases. The primary phase, which controls your post-meal blood sugars after immediately eating. The latent phase, the second phase, which is a constant insulin secretion secreted. So most patients can have both phases affected. Some can have just the primary phase as the first phase affected. In those people, the fasting sugars are higher, the post-meal blood sugars are higher. And in some other type of people, is the second phase which gets affected. So coming back to this graph, if you have developed diabetes in 2014, 50% of the pancreas is gone, then you develop diabetes. So for example, if your functional capacity of the pancreas is this big, I'm just talking not the size, the functional capacity, it goes to half to develop diabetes. So if you look at this, the 50% pancreas tends to go down, then develop diabetes. Over the period of 10 years time, your pancreatic production goes to hardly 10%. So this is the insulin production, which goes half and if you develop diabetes today, so by 2024, majority of the 50 to 70% people will have hardly 10% pancreatic capacity to produce insulin. So most people require some medications and later on require insulin therapy. And earlier you start insulin therapy is better for you. Insulin is safe, non-addictive. It just because you have reached this far, that's why you require insulin therapy. And if you look at whatever therapy you use, insulin will not be produced and we have to give you external insulin. And whatever insulin injection, because we cannot take it orally, the other forms of nasal or oral forms are still under research and development, at least not available in our country. Maybe available in future, but it's going to be very expensive. the best option remains the injectable therapy because it cannot be taken orally. So you have to give injections if the sugar is not controlled by a couple of medications and your sugar remains high. Insulin is very safe and is non-addictive in the sense that once your pancreatic function has gone down to smaller than 40 or 30%, whatever you do, the sugar will not control until you lose significant amount of body weight. And I keep telling them that, look, it's like putting a glass on. Once you put a glass on, we don't call you addictive. We call it your requirement. So once you put on insulin, that's your requirement. If you throw your insulin out, the blood sugar will go back to where it was. So we never call people addictive to glasses. We require it's a requirement. So it's not. So insulin is just like the glasses that you put on to control your sugar. If you throw it off, your vision would go back to where it was. So insulin is very safe and is required by most people on a long-term therapy. Some people require it for short therapy during hospital admissions or during pregnancy. Otherwise, insulin is very safe for the long-term treatment. There are several treatment options that what we can give for insulin, because the insulin is secreted after immediately each meal and one constant insulin, as I discussed before. So we have different options of insulin that we can discuss with you so that we can tailor-make your therapy. Some people require once a day with an oral tablet. Some people require 2 injection shots a day, and some people require 4 injection shots a day. So one long-acting insulin and insulin with each meals.